study presented at the World Congress on Osteoporosis found that women with low levels of vitamin D have significantly more hip fractures than those who had higher levels. This study actually followed over 1,000 women who had their vitamin D levels measured at the start of the study and again in 5 years. While over 20% of the women who had consistently low vitamin D levels experienced hip fractures, only 6.9%, just a little under 7%, of the women with high levels of vitamin D had hip fractures during the study. Even the women with moderate vitamin D levels had half the hip fractures that the women with the low vitamin D levels had. These researchers concluded that women with vitamin D insufficiency had a significantly greater risk in developing osteoporotic fractures. In the April 2014 issue of the Journal of the American Geriatric Society, a study was published that looked at cognitive function of well-functioning elderly subjects and their vitamin D levels. They followed these individuals for 4 years. Those individuals who had the lowest levels of vitamin D had the poorest cognitive function initially and also were noted to have the most rapid decline in cognition over the 4 years of this study. In the May 2014 issue of the American Journal of Clinical Nutrition, a study was reported that showed that supplementing with vitamin D in women who had low levels of vitamin D provided significant health benefits. The trial included 218 overweight or obese women. The women were assigned to a 12-month low-caloric diet and exercise. They also either received 2,000 IUs of vitamin D or a placebo. The women who received the vitamin D supplementation experienced greater weight loss, a greater reduction in insulin levels, along with a significant reduction in inflammation in their bodies when compared to those who did not supplement with vitamin D. Now, the results of a meta-analysis published in the Journal of Clinical Endocrinology and Metabolism revealed that cancer patients with higher baseline vitamin D levels at the time of diagnosis of their cancers have better survival rates and remain in remission longer than those patients who had vitamin D deficiencies. These researchers found that the strongest link between vitamin D levels and survival were noted in patients with breast cancer, lymphoma, or colorectal cancer. It seems like every month there's a major study showing the health benefits of supplementing your diet with vitamin D. It is important to realize that it is best to supplement with vitamin D3, which is the most potent form of vitamin D. I also recommend that you supplement somewhere between 2,000 and 4,000 IU of vitamin D.